Okay. So yesterday we discussed about the definition, nature of abnormal psychology, then various perspectives for abnormal behavior. And today we are going to discuss about etiology, the causes related to abnormal behavior. What are the etiological factors responsible for abnormal behavior? So the etiology, the causes in abnormal behavior concerns the study of these causes concerns the study of abnormal behavior. So the main purpose of abnormal behavior is to study the reasons, the causes behind that behavior. So why that person exhibit these abnormal behaviors, then what exactly turns into maladjusted or mentally ill? Yes, what factors turns into maladjusted or illness? So it's highly important for, we can say that highly important goal for all mental health professionals to understand the causes of abnormal behavior. So if we observe, there are important schools of thought which are developed to explain the origins of abnormal behavior and to suggest how it might be treated. Yes, what are the different views for this abnormal behavior and how we can treat it. So in this third unit, we are going to discuss about this is the third unit. I don't know the page number. So in this third unit, we are going to discuss about different viewpoints on causations and uh, causations for this maladaptive behavior. So these causes were broadly categorized into three areas. Yes, there are three categories. So those are biological causes, psychological causes, and socio-cultural causes. Yes. So in this third unit, totally, we are discussing about what are the responsible factors, what are the reasons for this unusual behavioral patterns or mental illness or disorders, psychological disorders. Yes. So if we take these biological causes, so the development of maladaptive or abnormal behavior, uh, we can say that it is significantly influenced by various biological factors. So these factors, these different types of factors can be classified into 5 categories. Yes, overall causes are broadly categorized into 3. And again, out of this, these biological factors are again categorized into 5. So in this, neurotransmitters. I'm not going in detail about what exactly the neuron, how it is function, and what are the neurotransmitters. All this information is given in detail in your textbooks, so you can refer that. We are just going to discuss about the important causes, how these factors, how these neurons, neurotransmitters, or brain injuries are responsible for this mental illness. Yes. So neurotransmitters are, we can say that these are the chemicals which facilitating communication between neurons, and these, if there is an imbalance in this, yes, if there is an imbalance in neurotransmitters such as norepinephrine, dopamine, and serotonin, and we can say this gamma aminobutyric acid. Yes, gamma aminobutyric acid, GABA. Yes, these are linked to various psychological disorders. So if there is any miscommunication taking place in these chemical substances, then that leads to various psychological disturbances. Then hormones. These hormones are chemical messengers which are released by endocrine glands. The hypothalamic pituitary adrenaline axis HPA axis, which plays an important role. So if there is an imbalance, which can lead to psychopathologies. Psychopathologies are nothing but psychological disturbances. So hormonal imbalances, which include in sex hormones, can also contribute for this maladaptive behaviors, not the general hormones. Various imbalances can lead to this unusual pattern of the behavior. Then this genetic vulnerabilities. Yes. So genetic vulnerabilities, it's like the transmissions, like traits or vulnerabilities which passed from one generation to another, which influences the predisposition to disorders such as schizophrenia, depression, and alcoholism. So for these disorders, this genetical predisposition is responsible. So we can observe like certain psychological disorders run into the families. Yes. Then uh, environmental interaction, if we see, this genetical expression can be influenced, not only passing from the genes from ancestors or parents. It's sometimes what happens, this genetical factors, when they associate with environmental factors. Yes. So both internal and external factors also responsible for this. What we can say that these are responsible for the brain development, or biochemical irregularities also can take place out of these factors. Then chromosomal abnormalities. So if there is an irregularities in chromosome structure or number, can lead to disorders. Yes, if there is any problem in the structure formation or formation of the number. Yes, for example, if you see this Down syndrome, so this is caused by a trisomy of chromosome where 21, there is a problem in the 21st chromosome, which leads to mental retardation. It is intellectual ability is very much affected due to this number trisomy. Then if we observe these constitutional liabilities here, what we can say, this early or parental detrimental characteristics such as low birth weight, which can be linked to later mental disorders. Yes, there is a WHO identified a specific birth weight. If it is less than that, 25,000 grams, if it is less than that, that leads to certain psychological disturbances in the later life. Then we can say that certain parental conditions as nutritional deficiencies or exposure to harmful substances, this also contribute to this psychological handicaps. Then certain personality characteristics like temperaments. Yes. So these early temperaments influenced both by genetic and environmental factors, because our personality is formed by this nature and nurture. Yes, both biological or genetical factors and environmental factors equally contribute for the personality development. So these temperamental factors plays an important role in this personality development. So certain traits like fearfulness and irritability in childhood experience, early childhood, can predispose individuals to anxiety disorders. Yes, at the early stage of life, if a person exhibits these temperaments, fearfulness or irritability, in the later life, they might develop this anxiety disorders. Then the next comes to the fourth category, comes under this brain damage. Yes, so significant brain tissue damage increases the vulnerability to the psychopathology. So while specific brain lesions, yes, specific brain areas are rarely the primary cause. Yes, if a person met with an accident or come across to any injury or something. So these factors can impair coping abilities and lead to an abnormal behaviors, especially in the elderly, most of the times we see that there is a memory loss, and there is an inhibitory things in reasoning ability, their intellectual ability. Yes. So this is due to this brain injuries or developmental issues. Then neuroplasticity. So this neuroplasticity is the brain's ability to adapt and recognize itself. Can be a factor in recovery or further development of psychopathology. So if any brain injury has taken place, so how well a person is recovering from it. Yes. So neural plasticity talks about a brain's ability to resilient out of the injury. So if it is not taking place properly, then this might leads to many psychological disturbances. Then if you see this physical deprivation or disruption, yes, the fifth category is a physical deprivation or disruption. So here, these physical deprivations may come under like conditions at birth as a prenatal stage. What factors may contribute for this psychological disturbances? So we already discussed about low birth weight. Yes. So WHO identified this 2,500 grams is an healthy birth weight. If a child's weight is less than this, then this birth weight can be associated with a higher incidence of neurological disorders and mental retardation. And one more important aspect immediately after birth is supplement of the oxygen. Yes. So lack of oxygen at the birth can cause permanent brain injury. So this condition is known as anoxia. So this leading to long-term psychological and developmental issues. Yes. So immediately after birth, if a child experiences this lack of oxygen, at least for a few seconds, this might have a profound impact on their development. So these factors, there's oxygen, weight, and neural factors, neurotransmitters, and what we can say genetical factors, physiological aspects, brain tissues, all these biological factors plays an important role in the development of psychological disorders. So always we cannot say that biological factors only plays a role, but still there is a huge contribution of this biological factors in the development of the psychological disorders. So if we able to identify this biological factors at the early stage, then we can easily diagnose and develop the treatment procedures and prevention for this. We can take measures to prevent these psychological disorders. So here, next, after this biological factors, next comes to this psychological factors. So under this psychological factors, first important aspect is Sigmund Freud's psychodynamic perspective. So, psychoanalytic perspective. Psychodynamic is later developed by various psychologists who are the followers of Freudian, but they have come up with their own theories. So psychoanalysis is exclusively Freud's theory. So according to Freud, so according to this Freud or psychoanalytic perspective, which focuses on the influences of the unconscious mind. So psychoanalytic theory mainly focuses on the unconscious mind on behavior. So it emphasizes the importance of unconscious process. Yes. Then the interaction between id, ego, and superego, and the role of defense mechanisms. So all these are the important factors which he emphasized more on. Yes. So first we'll talk about this unconscious mind, how this unconscious mind plays an important role. So Freud proposed that our mind is like an iceberg. Yes. So the small visible part above the water represents our conscious mind, while the vast submerged part represents our unconsciousness. Yes. What we are seeing, the tip of the iceberg is our consciousness, and the beneath of the water, yes, which is expanded, is the unconsciousness according to Freud. So these unconsciousness contains our repressed memories, forgotten, like forbidden desires and painful experiences. Yes, whatever the person wants to forget or repress, or he doesn't want to reveal or recall that information. All those unwanted information will be pushed to this unconscious mind. So all these painful experiences. So although we pushed it and we are not aware of these unconscious content, but this unconscious content is so powerful that influences our behavior. Yes. So according to Freud, compared to consciousness, this unconscious information is mostly influential in shaping one's personality. So what happens? These unconscious elements seek expression, and they emerge. See, those are suppressed. Yes. And that is more influential. So how do they come out? Yes. How do they shape one's personality? So they'll take different forms. Like we do see the dreams, our fantasies, and slip of the tongue. These are the various forms through which this unconscious information comes out and influences our behavior. Then he explained about this structure of the mind. So structure of the mind, according to Freud, has built with three important components. Those are id, ego, and superego. So this id is the source of our instinctual drives and desires. This id present right from the birth, and this operates based on the pleasure principle. Yes, seeking immediate gratification. So this is the important feature of this id component. And ego develops to mediate between the unrealistic demands of the id and the external world. Yes, what we need to do, what not to do, what is right, what is wrong. This is all maintained by our ego. It's a balanced state. So we can say ego is a bridge between this id and superego. So uh, ego actually operates based on the reality principle. So this ego always attempts to find the realistic ways to satisfy its desires. Yes. So if a person has a strong desire to go and hit another person, yes, with aggression, so ego balances that state, whether it's right or not. Okay. Then superego. The third component which forms one's personality is the superego. So superego is a internalization of societal and parental standards of morality. So whatever we are learning from our parents, from our society, it's all about values, ethics, morals. Yes. So it strives for perfection and judges our actions, whether it's right or not. Yes, and leading to feelings of pride and guilt. So people based on superego, we do maintain our values, ethics, yes, to what extent our actions are acceptable or unacceptable by the society. Then Freud also spoke about this intrapsychic conflicts. When this id, ego, superego works, if any conflict, it talks about it's a pleasure principle. It's immediate gratification. ego balances it. Yes, realistic principle. Superego talks about the moral principle. So when there is an interaction between these three principles, there is some conflicts do takes place. Yes. So one is morality, one is reality, another one is pleasure. So here, when the interaction between this id, ego, and superego is taking place, this can leads to some, definitely leads to some conflicts. So which are known as intrapsychic conflicts. So these conflicts arises because each component has different goals, as we discussed earlier. So the id, so how a person is balancing these three components and to what he is giving importance, that defines their personality. If a person is giving importance driven by the id impulses, then the person might lead to this criminal behavior, because it is the ultimate goal of this id is gratification. Yes. So moral principles, it's all about morals and ethics. Sometimes it is not uh, beneficial for an individual to follow this too much of morals and ethics. So it's all depends on how the person overcome this conflicts. So sometimes to like unconsciously a person always tries to protect their ego. Ego, according to Freud, is a reality. In the presence, what is right, what is good for an individual. So for that, to explain how a person protects their ego, Freud came up with the concept of defense mechanisms. So these defense mechanisms are purely works at unconscious level. Person has no clue about, and we do use this to protect our self, protect our ego. So he has given various defense mechanisms like denial, which refuses to accept the reality or facts. Displacement. Displacement is redirecting emotional impulses to a safer target. Yes. Then rationalization, repression. There are so many other defense mechanisms he explained about. Then this is about Freud's view towards the abnormal behavior. Then behavioral perspective. So according to this behavioristic view, this is emerged in 20th century. This has developed as a reaction against to this unscientific methods of psychoanalysis, because psychoanalytic theories, it's all very much subjective in nature. Yes, Freud, most of his experiments, Freud's experiments were conducted on his patients and on his own. So it is very much subjective in nature. So behavioristic point of view is they all behaviorists believe that it is very much unscientific, very much subjective. So what they thought, when we are identifying a cause, it should be empirical in nature. Yes, it should be observable and measurable. This we already discussed in yesterday's session also. So the key elements of this behavioral view is here, according to behavioristic perspective, every this normal or abnormal behavior of an individual is learned. Yes, we can learn the behaviors as well as unlearn the behaviors. So there are two important components which explained about this learning pattern of an individual. That is, one is given by Pavlov, Ivan Pavlov, that is classical conditioning. So according to him, learning occurs when a neutral stimulus, that is conditioned stimulus, is paired with an unconditional stimulus, and which elicits the natural response over time. Yes. So that we can observe in his experiment, that dog's experiment, how he, that Bell, yes, In the initial stages, he rang the bell and provide the meat to the dog. And later, the salivation, what he observed, not because of the meat, it's directly because of the bell. When he rang the bell, the dog immediately starts salivating. That is a response, conditioned response. Yes. And what is the conditioned stimulus over there? The bell. So we are learning the association. So through associations, we can learn the patterns or unlearn the behavioral patterns. So for example, like anxieties, phobias, fears, all these are the learned behaviors according to this behavioristic perspective. So this classical conditioning has given certain principles like extension. Then they have given this discrimination, principle of discrimination, extension, and what we can say that generalization, discrimination. Yes. So all these things we are not discussing in detail now. Then another important concept is about Skinner's operant conditioning. So according to Pavlov explained about the associations, how we associate between two stimulus. Yes, one is conditioned stimulus, another one is response. So he spoke about associations. And Skinner, he explained about a person learns certain behaviors based with the help of reinforcements. So that can be a positive or negative reinforcement. He has came up with the concept of punishment also. Then the third concept is about cognitive behavioral perspective. So here, according to this cognitive behavioral perspectives, they says that they emphasize more on how thoughts and information processing, how a person thinks and how he processes the information leads to maladaptive emotions and behaviors. Yes, it's not about our childhood experiences. It's not about our genetical factors always. It's not about some external factors, but how our cognitive aspects plays a role. Yes, how we are perceiving the situations, people or objects, or how we are understanding, how we are analyzing. These factors plays an important role for the development of this maladaptive behavioral patterns. So if we observe this key components is cognitive distortions. Yes, irrational thoughts, irrational beliefs, irrational reasoning. So this cognitive behavioral therapy focuses on how to uh, channelize these thoughts, how we convert these irrational thoughts into rationalization. Yes. Then next concept is about humanistic perspective. So if you observe clearly, second unit and third units more or less the similar. Yes. So here only the difference is second unit, all these approaches we are talking in the context of how these different schools perceive abnormal behaviors. And here we are studying how they explain the causes. Yes. How this biological school of biological perspective or cognitive school of thought or psychoanalytic school of thought, how did they explain about causation for this behavioral problems. So that's the only difference. Yes, I hope you people are understanding. So humanistic perspective, if we see, they have emphasized more on human nature. Yes. So this humanistic perspective holds a fundamentally positive view towards this human nature. And they suggest that people are inherently good. Yes. And capable of personal growth. Okay. So this is the important view of humanistic school towards. So we can say that they are saying people themselves are responsible for their behavioral pattern. Maybe it is a normal functioning behavior or abnormal pattern of behavior. So they focus not on, they focus mainly on present. Unlike Freud, Freud emphasized more on childhood experiences, past experiences, but humanistic school mostly emphasize on the present experiences, what people are going through. So according to them, people should leave their past and they should move away from their past and live in the present. So they do talk about the presently, how they can shape their behavior, how they can enhance their capabilities, yes, how they should be goal oriented. So they focus more on these kind of aspects. Then they do talk about this complexity of human behavior. So they argue that many empirical studies on causality oversimplify human behavior, which is, according to them, human behavior is more complex and multifaceted. Yes. Then uh, this this approach focuses on therapeutic goals. So this says that people's attitudes and how they are leading their life, how they can fulfill their lives. So they focus more on that and they emphasize more on growth. If you observe this humanistic psychologist, Abraham Maslow, he came up with the theory of need hierarchy. And if we see this Carl Jung focused more on this self-actualization, how a person can reach to this self-actualization. Self-actualization is nothing but achieving one's highest potential. Yes, whatever the capabilities and potentials a human being has, how to achieve it and how to achieve their goals. So they are people using their highest potentials to reach the goals in their life. So that is what the ultimate purpose of human nature. So this is how Carl Rogers and Maslow contributed through this humanistic uh, perspective. So according to this perspective, the causes for psychopathology is ego defense mechanisms, then social conditions and learning, then excessive stress. The next comes to this existential perspective. So this existential school rooted in the philosophies of thinkers like Martin Heidegger and Soren Kierkegaard. These are the people who emphasized the uniqueness of the individual, the quest for meaning and personal freedom. So they focus more on how a person finds the meaning in their life. Yes, what is their existential? What is the purpose of their life? So they focused more on this. So they wants to. They said that every individual's nature is to find the true person in them. Yes. So how they can achieve it? The actions and choices they made in their lives. Yes, what kind of actions they are taking, what kind of choices they are making, what kind of choices they are making about their personal life, professional life, religious life. Yes. So these are the important key points in existential psychology. Then if we see the causes, what are the causes they explained about this for this psychopathology is existential anxiety. So this existential anxiety is nothing but awareness of life's finitude and the responsibility of creating a meaningful existence. Yes, which can lead to existential anxiety. Then failure to address existential issues. If a person unable to find the true meaning, unable to identify the true purpose of their life, this might leads to abnormal behaviors. Then if we observe, there are community and cultural perspectives like what is the social support system for an individual, what are the maladaptive behaviors they have adopted, then what are the cultural variations. Yes. So according to this, the causation is this inadequate social support and resources, and uh, there is no such preventive measures. Yes, there is no such exposure or awareness about psychological disturbances, or what we can say that uh, hospitalizations or other things. Then social disorganizations like poor schools, high crime rates, inadequate housing, and prejudice. All these can lead to personal problems in an individual, and this might lead to maladaptive behavior. Then social selection. So here there is one social selection theory which suggests that people who experience maladaptive behavior tend to move into lower socioeconomic groups due to their inability to function well. Then if we move forward, uh, there is an cultural factors and social factors like parenting styles, like authoritative parenting, authoritarian parenting styles, neglectful parenting styles also contribute for this pathological behaviors. Then interpersonal relationships, socio-cultural causes like disasters, war-like situations, poverty, then social discrimination. So all these factors also plays a major role in the development of this psychological disturbances. So all these causal factors are from third unit. So we discussed about biological factors, psychological factors, and socio-cultural factors. So these are the three broad categories. If we move to the next unit, it's about anxiety disorders. So fourth unit, totally dedicated to this anxiety disorders. So people, most of the times they get confused between this, what exactly the anxiety is and what is fear. So if you see the definition, anxiety is a general feeling of apprehension about potential future danger. It is not about the present, not about the specific stimulus. It's always about, most of the times it's about the future danger. It is characterized by a diffuse, unfocused, and often chronic worry that something bad might happen. Yes, they are not clear about. So this is anxiety. Then if we come to fear, fear is an alarm reaction in response to immediate danger. Anxiety is a future related, and fear is a present one. So it's person's reaction towards an immediate danger. They might have seen something like if a person see a snake, there'll be more, what we'll say, uh, it's their reaction. They'll run away from that situation, or there'll be more panic. So this is an immediate response or reaction towards that stimulus. So that is a fear. Anxiety is if a person is worried about their future uh, job, career aspects, or if he worried about his health or family or something, then we can consider this as an anxiety. So here the fourth unit totally focuses on 5 specific anxiety disorders. So each with unique response to anxiety. Each one will have a specific characteristic towards anxiety. So in this first, if we observe generalized anxiety disorder. So if you see the definition for this generalized anxiety disorder is characterized by chronic and excessive worry about a variety of events or activities which occur more, what we can say, these worried, chronic and excessive worry about a variety of events or activities. Like it's a throughout their daily activities, they are more worried and anxious about their daily routine or daily activities. So if it is persistent for more days or for 6 months, then we can consider this as a generalized anxiety. Yes. So this worry, this continuous worry is disproportionate to the actual risk, because we already discussed that anxiety, the definition itself is irrational fear towards the future aspect. Yes, there is no present realistic danger is implied over there, was there. It is totally about the future. Yes. So here their ultimate anxiety or worry, it's all related to the future things. So there is no ultimate danger is present. Okay. If we observe the diagnostic criteria, so we are following DSM-5 diagnostic criteria to categorize these disorders. So according to this DSM-5, it is like this anxiety, the worry, whatever people are experiencing, it should occur more than like more days or at least 6 months, continuously 6 months. If a person experiences this continuous worry or fear towards unrealistic fear, or what we can say the future aspects, that is one criteria. Another one is difficulty controlling the worry, the person unable to control this worry. Then the anxiety, what we can say that there are DSM-5 has given certain symptoms, yes, certain characteristics. If a person is, what we can say, the person is the person exhibits at least 3 symptoms out of this, like the symptoms are like restlessness, fatigue, difficulty in concentrating, irritability, muscle tension, and sleep disturbance. So out of these 6 to 7 characteristic symptoms, if a person at least has 3 symptoms continuously, we can consider this as a generalized anxiety. Then these worry or symptom shouldn't be any other significant, clinically significant distress or impairment, yes, in social, occupational, or other important areas of functioning. It shouldn't occur because of something else. Yes. Sorry, this should impair his lifetime. So when we call abnormal, when a behavioral pattern of an individual is interfering with his personal and professional life. So this excessive worry or fear is interfering his personal life, interfering his professional life, then also we can consider it. Then this disturbance is not better explained by any other mental disorder. Yes, it shouldn't overlap with. So if a person qualified with all these criteria, then we can say it is a generalized anxiety disorder. So causes for this generalized anxiety disorder can be an imbalance in neurotransmitters, such as serotonin, norepinephrine, or this GABA, or genetic predispositions are responsible for this. Then if we observe this psychological and environmental factors, such as unresolved unconscious conflicts, and according to psychodynamic perspective, psychoanalytic view, then cognitive biases framed in childhood, the cognitive biases a person framed in his childhood, and they exhibit what the childhood experiences they are experiencing in the adulthood, in the later life. Yes. And we can say that significant life events or traumas or stressors also can lead to this generalized anxiety disorder. So if we observe or focus on this treatment, CBT is helpful, which involves cognitive restructuring to challenge inappropriate assumptions. And we can use this relaxation training to manage physical symptoms. Then certain anxiolytics like pharmacotherapy, also like certain antidepressants also useful in treating generalized anxiety disorders. Then panic disorder. The next aspect, the next anxiety disorder is panic disorder. So if we observe the definition, this panic disorder is characterized by recurrent, unexpected panic attacks, which are sudden periods of intense fear or discomfort that peak within minutes. Yes, this is the definition. If we observe the symptoms of this panic disorder, so if we observe the physical symptoms, it's like palpitations, sweating, trembling, shortness of breath, feelings of choking, chest pain, nausea, dizziness, chills, or heat sensations. All these are the physical sensations we can observe. Then cognitive symptoms is fear of losing control, fear of going crazy, fear of dying, depersonalization, and derealizations are the what we can say cognitive symptoms. Yes, if we observe the diagnostic criteria, here we are saying this recurrent, unexpected panic attacks. Yes, so these attacks should be at least one of the, like whenever a person experiences a panic attack, he should experience one of the, what they have given the symptoms, one or both of the symptoms should be qualified. That is persistent concern, like continuous concern or worry about additional panic attack. The person should be always in a situation, always in a worry that he or she might get more attacks on a frequent basis. Then a significant maladaptive change in behavior related to these attacks. People will be very much panic, very much, they show all these physical and psychological symptoms by thinking about their future attacks. Yes, there is a major change or shift in their behavioral pattern. So because of this fear, they might not go out, they might not socialize, or uh, they might stop going to their office or work or something. Yes. So causes, the reasons for this panic attack can be like genetic predispositions, abnormalities in brain regions, which brain regions means there are particular brain regions which involve this fear response. Yes. The brain regions or areas responsible for this fear. Then, if we see this psychological factors as stressful life events, sensitivity to anxiety symptoms, or we can say that maladaptive thinking patterns, all these also can be causal factors for this. Here, for treatment, we can use again uh, under this CBT, we can use this exposure therapy. So this exposure therapy will be useful to treat these feared sensations and situations. Then antidepressants and anxiolytics also useful. The next category is about phobias. Yes, first we discussed about generalized anxiety disorder. Then second one is about panic attacks. Third one is about phobias. So the definition, if we observe a phobia, phobias are characterized by an intense, irrational fear of specific object or situations, which leading to avoidance behavior. Yes, what we are observing here the fear is intense and this is irrational. Okay, so person also knows that, for example, if a person has a fear of lizards, yes, so person is aware that this is unharmful, but still the person experiences that irrational fear in the presence of that particular stimulus. Yes, so that's the reason it is called irrational. So it is intense as well as irrational fear of specific objects or situations. Whenever the presence of that stimulus, the object is present or that stimulus is there, the person experiences. Then there are two types in this phobias. One is specific phobia So specific phobia related to that specific objects or situations, like particular animals or heights or something we can say. Then social phobias. It's like social anxiety disorder, fear of social situations one might be where one a person can be analyzed or scrutinized by others. Yes, wherever a person knows that people are going to judge them or people are going to scrutinize them. So they develop this fear. One is related to specific objects or situations. Another type is related to uh, social aspects. Then the diagnostic criteria, if we observe here, the diagnostic DSM-5 diagnostic criteria is it's a marked fear or anxiety about a specific object or situation. Yes, it should be the person should experience this intense fear only in the presence of that particular object. Then always, whenever the person is come across to that object or that stimulus, he should exhibit the similar kind of fears. Okay. The next criteria is the person actively always tries to avoid or endued with intense fear of anxiety. He always tries to avoid that stimulus. Then this should be like out of proportion to actual danger. Yes, generally there shouldn't be any danger with that stimulus, but still person is persistently experiencing this anxiety or fear. Then this avoidance, whenever he tries to avoid the heights or tries to avoid, for example, if a person has an fear of dogs, yes, so continuously he tries to avoid. So there are so many dogs on the street, so he avoid going in that street. So this leads to what we can say significant distress or impairment in that individual. So again, duration should be at least for 6 months. The person should experience this continuous fear towards that particular object. Then reasons, if we observe here again, it is like certain phobias are more common because they pose a survival threat in ancestral environments like fear of snakes, fear of wild animals. Yes. Then, according to psychoanalytic view, phobias are manifestation of repressed conflicts, like undesired, certain desires or feelings or motives. Yes, if a person continuously trying to repress, that might come out with an conflict and that might lead to some uh, malfunctioning or what we can say disrupt in their behavior. So again, here also this exposure therapy or systematic desensitization, cognitive restructuring is useful in the treatment procedure. Then along with CBT, uh, all this exposure therapy and all systematic desensitization, cognitive restructuring, all comes under CBT only. Along with that, we can use certain uh, pharmacotherapy, psychopharmacotherapy also useful. The next category is obsessive compulsive disorder. People do use this OCD very frequently. Yes, it's uh, like if a person is taking some preventive measures. Yes, washing their hands bit frequently, people start blaming that individual as labeling that individual as OCD. But OCD has certain specific characteristics. Yes. So if we observe the definition of OCD, it is characterized by the presence of obsessions. Obsessions are recurrent and persistent thoughts. Yes. One is obsessions related to thoughts and uh, feelings. And the other one is compulsions. Those are repetitive behaviors or mental acts. Like behaviors like frequently washing their hands. Once or twice, if a person is washing their hands, it is quite common. But continuously, if a person is not satisfied with by washing twice or thrice, continuously, if they are washing, then this comes under compulsion, the compulsive behavior. The person can't control that behavior. So, diagnostic criteria, if we observe, presence of obsessions and compulsions, both thoughts and behaviors. Maybe in some cases, maybe only obsessions are there. In some cases, only compulsions, and in other cases, it's both. Both thoughts and behaviors can be observed. Then the obsessions or compulsions are time consuming. The person is getting delay for the interview or some other important work, but still they go on wash their hands. Yes, it is interfering. So it is most time consuming or cause significant distress. Then the symptoms are not attributable to the effects of a substance or another medical condition. Yes, the person has some wound or something. That's the reason the person is washing their hands. If that is the reason, we cannot consider this as an OCD. Nothing is there. There is no medical cause. It is not happening because of the side effect of some medicine or something. No, there is no other reasons related to substance or any other medical condition. It is because it is due to that compulsive thoughts or feelings. Then causes can be genetic predispositions, abnormalities in the brain circuits. Then psychological factors can be a person's belief system, maladaptive belief system, or we can say sometimes it's a learned behavior. Again, CBT and pharmacotherapy is useful in the treatment of this disorder. So the final disorder related to anxiety disorder is PTSD, post-traumatic stress disorder. So this post-traumatic stress disorder characterized by the development of severe anxiety and other symptoms which are following the exposure to traumatic event. A person, for example, a person lost their loved one. So after that, the person is experiencing a lot of stress or severe anxiety. So if we observe the symptoms, okay. So more or less we discussed about all this, all these anxiety disorders, their characters, uh, criteria, DSM-5 criteria, then causation and treatment